All right. So I ended up actually doing my whole presentation without recording it, which is unfortunate, but it's okay because I'm going to share my screen real quick. But that I just went through my whole presentation without recording it. So that was a little embarrassing, but that's okay. All right. So hopefully you can see my screen. Um, so my presentation is on the interview I did with a health program analyst. So I'll run you through what we talked about. So, what is a health program analyst? A health program analyst is someone that oversees health programs and makes sure that they succeed. And if they don't succeed, then they investigate and analyze what went wrong and adjust the program to perform better, or they end up just removing it altogether if it doesn't perform, if it doesn't work. So the person that I interviewed is Natasha Sastry. She's a public health analyst at the Department of Public Health in LA. So she originally wanted to excuse me, she originally wanted to specialize in epidemiology and infectious disease, and she's worked there for 6 years, and she got hired during the start of COVID, actually, to be on call for support regarding the pandemic. So she spent the first 2 years of her career supporting the deployment of vaccines. So she administered patient experience surveys at the end of vaccination appointments and worked on incentive programs for vaccinations um, in underserved areas. So then she spent the next year, the following year, investigating workplace outbreaks. So the guidelines were that if there was a minimum of 3 people sick in a workplace, they were mandated to report it to their Department of Health. So she'd use floor plans and analyze and investigate if there was actually an outbreak because there were a lot of false outbreaks. And the health guidelines were changing so quickly due to the emergency pandemic that just occurred. So she and her team also had to research and educate others on what the new guidelines were. So for the next 2 years, she was on the antigen test community distribution team, and she also worked as a warehouse manager. So she helped form partnerships with community organizations, and she also managed warehouse inventory and distributed various types of personal protective equipment like gloves, hand sanitizer, masks, and more. So the overall goal with their work was to keep the community safe with access to good tests. And for the last 6 months to a year, she's been working on the community health stations. So in her community, she's been working on the health stations. So the goal with this work is harm reduction. So they use the community stations to make what lower income communities need to lower the risk of health and disease um, more accessible. So they make them, free and they make them local so you can walk to them, from your house or from your school or something like that. Um, so doing this gives the control to the people and reduces health disparities as a whole. So, her job, um, actually, as a health program analyst, relates to the essential public health services in 2 of the 3 categories. So, the policy development category and the assurance category. So, in the policy development section, her position helps the community effectively um, inform and educate the general public and strengthens, supports, and mobilizes communities and partnerships by making quality tools and education accessible and affordable. And the assurance for the from the assurance section, her position enables equitable access, and her being in her position also helps build a diverse and skilled workforce. So I had about 7 interview questions. So the first interview question is, as a health program analyst, do you have a specialization? If so, what is it? If not, share some types of programs you've worked on. So this was just to get an insight on what typical, what a typical workday, work week looked for Natasha and what her desired career focus was. Interview question two was, during your career, what are some of the core issues you see in the community revolving around health? So, this was just to get insight on the main issues seen in her specific community and also the general community of our country. So the third question was, how do you feel um, physical activity plays a role in the community's health? Is it a priority, or are there more important and urgent issues? So this was just to measure kind of like how urgent is physical inactivity in her community, and also compare it to other public health issues. So question number four was, how do you get data from your community? What types of surveys, focus groups, research studies, and analysis occur for your data? So this was just to get more of an in-depth look on the credibility, so where you're getting your information from, where you're getting your data from. This was also good to get types of data and the different types of the size of data. So, how much information are you getting? How much data are you getting? What types of data are you getting? Because a survey and a focus group are very different. They have their upsides and their downsides. So I wanted to kind of get a good glimpse of what that looked like. And then my fifth interview question was, what lessons and skills have you learned from your career? So just, what did you learn from your job experience? Like, what have you learned in the past 6 years? I know she's definitely like learned a lot in the past 6 years from working, especially during COVID. So, what did she learn? The sixth question was just, what are some of the benefits and challenges of your career? So, everything has an up and down side. And I just wanted to get a good idea of like, what her strengths and weaknesses were, what she thought was good, what she thought was bad in terms of her job situation. I know it was a lot of high stress situation, so I kind of want to get some insight on that. And my last interview question was, why do you feel like the work you do is important? So this was just to get, a little anecdotal um take from her about her personal experience on public health work. So, my results, I had a lot of results. Um, but for the first result that I had was, in conclusion that I came to, was just that there are a lot of positions to fill in public health. So there are underserved communities in every state that need help from their public health departments. And there need to be people in charge of distribution, inventory, marketing, education, and so much more. So that was just, there's just a lot of positions in public health and a lot of, definitely needed and high demand positions. Next, accessibility reduces health disparities in the long run and gives people some control regarding their health. Meeting people where they're at or where they are is important to establish trust with the community. Then issues vary based on the specific community. So even though there are, universal issues that affect the general public. There are specific issues that affect specific communities depending on where they are, who's living there. So many other factors can come into play. Specifically to LA, the opioid crisis is the main public health issue. The department is working on reducing overdoses and deaths through community health stations and education. Then the next conclusion I came to was destigmatization of diseases and health conditions are clearing up misinformation is key to empowering the general public to take control of their health. It's also important, especially to educate the general public about what public health specifically is. A lot of people think public health is restaurant inspections, but it's so much more than that. Public health is prevention. It's making clean water accessible and educating people on the use and safety of seatbelts. So it's just prevention, preventing deaths, preventing disease, preventing spread. And public health is just in general such a broad topic. Kind of everything can relate and come back to public health. An unfortunate conclusion that I made was just that physical activity is unfortunately a privilege when it shouldn't be. It should be accessible to everyone for free or very low costs. People need their basic needs met in general before they can focus on physical activity, which is one of the biggest hurdles, is that physical activity either costs you money, time, or both. So a lot of people don't have money and time, or both of those things. So if someone, is struggling to eat and drink clean water and have shelter and have to think about where they're going to sleep the night, they're not going to think about, oh, what split am I going to go hit at the gym, what how many miles am I going to run when I go to the gym later. They're not going to the gym because they don't have time or the energy. They have other priorities that really can end up costing them their lives. So they need to focus on living and surviving and not sorry, they need to focus on surviving and not living. So that's unfortunate, but it's a lot of people's reality. So um and also just the general public, it needs to be educated on how to start being physically active because there's a lot of misinformation surrounding the fitness industry and people need to access the facts. Then another conclusion I made was just that anonymous surveys have their benefits and their challenges. So a benefit is just that, there's no face-to-face interaction and there's no room for judgment. So it makes the survey taker more comfortable and, you know, just feel better about not being judged. And then the downside to that is just that the survey providers can't follow up on the recipients and link the decrease in disease spread and deaths to the increase of community health stations because they can't be like, okay, like did this help? Like, how did this help you? Like, 5 years into it, did this help you? Like, um, does this help you save your life? Did this help save someone else's life? You can't follow up on it, so you don't really know. You can't really confirm the correlation. And then lastly, the work of public health departments is a small part of the large goal, the large general goal, that hopefully everybody thinks about of attaining global health equity. So humans need to help each other, and the healthcare system in general is just so broken in America. So it needs to be reimagined and changed. We need to get ahead so that we can limit the number of health problems that we're treating that could have been prevented altogether and altogether like all in the first place. They could have been prevented instead of having to treat them now. Um, and an interesting statistic that she shared with me was just that clinical care only determines 20% of the health factors, and the rest is behavioral, environmental, or societal factors um, that determine the other 80% of health factors, which I thought was really interesting, but it makes a lot of sense. Um, which those are more preventable things or alterable things. Um, so yeah, those are the conclusions that I came up with. And now to get into the benefits, so based on the interview, the main benefits of integrating the essential public health services are early disease detection, which prevents disease worsening or spreading. Um, and Tasha also really provides a diverse um perspective, being a queer person of color, which was very interesting to find out because she's part of two marginalized communities. So she offers a very good, diverse perspective on the marginalized communities that she's serving. And then lastly, the collective shared values are wanting to help people, create a better, healthier, safer future for all Americans. So just the shared values that they all kind of share in the department that she works in. That's definitely a benefit. It's nice to work with like-minded people. And then the challenges, so the main challenges of integrating the essential public health services um, are the bureaucratic structure of a lot of departments and the red tape, slowing processes and procedures down, collecting data. It uses a lot of resources. It uses, it can be expensive and very consuming of people and time. And then lastly, just health being political is a big challenge in general. It's rooted in racism, in patriarchy, and in capitalism, which benefits such a small portion of society, while leaving the rest, with less access and less quality um, tools and education. So, it's really important that health starts shifting from being political to being essential and being non-negotiable. It's very important that we start to shift there instead of, staying with the, oh, you know, health, you got to pay for it. Um, there's plenty of other countries that have universal health care. I'm pretty sure the US is one of the few, is probably the main one that does not have universal health care. So it's a very important thing to think about. But thank you for listening. This was a super interesting experience to be able to interview someone and then yeah, so just comment any questions or any constructive feedback that you might have for me. And yeah, I hope guys have a good rest of your day and a happy 4th of July.